and Region 4A. These areas have a very high risk for COVID-19 transmission as well, and I am really concerned about these two regions. Region 3, despite high COVID transmission, high risk for COVID transmission, we have seen some areas in Bulacan, with the high number of cases. But the good thing about Region 3 is they are doing preventive vaccination, meaning to say they do catch up. It's an ongoing process. I think that is the best practice for Region 3 kasi they do analyze the reports very, very well, and they tend to do preventive activities rather than containment of an outbreak or clustering. They do preventive activities. And for BARM, I guess it's one of our concern as well, because aside from the usual challenges that we encounter in providing immunization, they also have a peace situation, issues there. So plus some of the areas really there are a lot of children. So I think those are the regions that are concerning as far as outbreak is concerned for vaccine preventable diseases.
Doctora, I've seen your TV campaign for polio. Are we thinking of doing this for other vaccines that are also important? I think it's very effective kasi ngayon lahat ng tao naka-glue sa TV eh. Oh. Meron pa ba tayong budget for that? Oh.
Meron tayong ipapalabas uli, because hindi ko alam kung na-preempt ko na, pero dapat alam na nila, because we're also thinking of doing a nationwide measles rubella campaign. You know what's interesting? 2018, 2019, ang taas ng measles natin. The outbreak is huge, particularly here in Luzon, NCR. But then 2020, first few months, January, February, and half of March, we have a lot of measles cases. But you know what's on the rise? Rubella. So we saw more than 200% increase of rubella cases from 2019 to 2020. And this makes me really concerned, particularly health workers attending to COVID, and then all of a sudden may measles, rubella, and then nasa reproductive age group sila. We don't have a CRS surveillance yet. So yeah, this is also a concern. That's why we are planning to do a nationwide measles rubella campaign, dovetailing polio as well, oral polio vaccine for those areas who haven't implemented the outbreak response for polio. So yes, you will be seeing a lot of immunization activities on TV, over the radio, in the upcoming months.
Doctora Bravo, you were raising your hand. Yeah. Doctora Bravo cannot be heard. Can you unmute Doctora Bravo, please?
This is your question was very valuable, because we are not just going for polio, and definitely not just for measles, rubella. We are a country now, and I have seen that in the Asia Pacific region. The Philippines is one country that has tremendously suffered from vaccine hesitancy, from a very low vaccine coverage. So all the vaccine preventable diseases are at risk, whether it is not just polio, measles, rubella. We have pertussis. We have succeeded in maternal tetanus. We have succeeded before in diphtheria. My God, it's all coming back. If we do not do our role in telling people, please vaccinate, vaccinate, vaccinate. Otherwise, we are gonna be the sickest man in Asia. I really hate to see that, because we have seen the glorious years of vaccination in the Philippines. We hope we will not be at the bottom again.
Yes, yeah. I'm an OBGYN, Doctora, and when you mentioned rubella, I got scared because, it affects our reproductive age women. But the sad thing here is rubella is so inexpensive. No, the vaccine is so inexpensive. That's why we really believe that we have to be very aggressive with vaccinating them when they're not really sexually active yet. Do you have like an age group where you would say that kailangan bakunaan na to? Kasi if you remember, there are some reports now that the sexual debut is really getting lower and lower. Or do we just try to vaccinate everyone? What is how are you going to do your campaign, Doctora, for the rubella vaccination? Which comes in MMR now because there is no pure rubella vaccine anymore. Yeah.
For the campaign vaccine, we're using the MR, and the target age group still is under 5 years old. But we do have a regular program in the Department of Health. This is in coordination with the Department of Education and DILG. However, it's called school-based immunization, wherein we provide MR vaccines for grade 1 and grade 7. Unfortunately, walang face-to-face ngayon. So we cannot do that. It's usually done during every August. August is school-based vaccination month. Unfortunately, since walang klase, we cannot do that. But in some areas, they are looking for yung mag-grade 1 at mag-grade 7, and they are providing them with MR vaccines because we have a supply for that. So it's from school-based to community-based naman sila ngayon. But again, not all regions are doing that because some regions are really limited because of the COVID-19 pandemic. Now, unfortunately, there is no program for the department in the Department of Health that is taking care of reproductive age women as far as their vaccination needs is concerned. And having said that, budget as well, walang nakalaan sa kanila. Yes, walang nakalaan. That is why, again, actually, this is now being proposed by the National Immunization Program for 2021. Ang daming kailangang gawin, no? Ang daming kailangang i-propose. That's why we need champions, Dr. Lu. It's a good thing merong inilatag na batas sa Kongreso para sa mga health workers on COVID, on flu and pneumonia vaccination. When I read that bill, I wrote a position paper to include, not just the flu and pneumo vaccine for health workers, but also, hepatitis B vaccine, measles, rubella vaccine, and other vaccines that will be decided upon by the NITAG or by the HTA beneficial for our healthcare workers or frontliners. So I hope, I'm crossing my fingers, I get the support and the funding for that.
Actually, you know what, Dr. Wilda, the silver lining for this COVID is that now everyone, including our policymakers, are really realizing the years that we have underfunded our Department of Health. Diba, during the pre-pandemic, they even cut the budget of DOH. They did not think that the DOH need all of this funding. Now they're realizing that the health of the nation will be important for economy of the nation. Now I'm sure you will get all the attention.
As we always say, preventive medicine is always better. A question for Dr. Bravo. Do you see in your practice an increased incidence of pertussis among your children, especially the newborns?
Oh yes, actually, that is connected to what we call complacency. Because years ago, when we had been successful in our vaccination, these diseases started to disappear. Diphtheria, pertussis, and polio, of course, tetanus. And so people started to become complacent. And then I'm sure the one that really made it happen, the decrease in vaccine coverage and vaccine confidence, is the Dengvaxia in 2018. People became scared of getting vaccine. And that has really made it possible for all of these vaccine preventable that we have decreased so far come to reappear again. That's the
Yes.
reason why we're appealing. We're appealing to everyone to please make sure that you are well on the road to recovering the trust in vaccine. We need that for everybody to really think about.
You know, Doctora, the reason I asked that also, with the POGS, the Philippine OBGYN Society, we're all encouraging everyone to vaccinate the pregnant patient at least with 1 dose of Tdap. However, sometimes for our patients, especially our charity patients, when we ask them to go to the local health center, we don't have Tdap in the local health center. But the one that really kills, even if you say that maybe pertussis is not really that high, but the mortality rate is quite high at about 60%. At least that's the report. And so it is, I think, something that we have to look into. Now I understand when Dr. Silva mentioned na wala palang nakaalat sa reproductive age. So maybe that's also one of the reasons. So maybe we can look at that. Kasi isa lang naman yung kailangan sa tatlo. Hindi naman kailangan lahat
Okay.
Tdap. Yeah,
Yes. Actually, we have the immunization program, immunization for pregnant women. At least 2 doses of tetanus diphtheria. It's TB, the capital D and the small letter D, but we do not have a cellular pertussis in
correct.
yes,
Yeah.
in our routine immunization program. But the new guideline says if you get like complete immunization from routine, primary series, and then you have a booster at the second year of life platform, plus you have grade 1 and grade 7 vaccination, because grade 1 and grade 7 vaccination is not only MR but also TB. Then pagdating sa reproductive age, hindi mo na kailangan kasi naka-6 ka na. Actually, 6 doses of tetanus containing vaccine. That's the recommendation of in our maternal and neonatal tetanus elimination program. We do have that.
You're correct, Dr. Silva. Ang problem kasi sa atin, wala tayong recording. No? A lot of our patients, when we see them, they have no idea at all, no, what they have received. No, we still have a lot of questions, but sad to say, all good things must come to an end. No, so it's 1:40, and I believe we have discussed vaccination in the time of a pandemic very well, thanks to our very, very excellent speakers. So thank you, Dr. Bravo. Thank you, Dr. Silva, for very interesting, very comprehensive lectures. Very, very good discussion for in our Q&A for immunization in the midst of the COVID-19 pandemic. And what have we learned? No, in today's webinar, we know that immunization is a global success story. We've known that for a long time, and it has saved millions of lives. Dr. Bravo has told us to improve the lives of many. These vaccines, especially the marginalized populations, really need them most, and that's the only way we can improve their lives. We are facing a setback today with our immunization program because of the COVID pandemic, but now, more than ever, we need to continue this advocacy, immunization as a vital public health program, no? And if you take a look at the other messages of Dr. Bravo, vaccines have several benefits: promoting peace, empowering women, enabling international mobility, and contributing to economic growth. Vaccines prevent diseases and greatly benefit all of us economically, especially the disadvantaged populations who cannot afford the cost of treatment of certain diseases. Especially today, antibiotic resistance is growing, making prevention the better way to do it. And I'd like to quote her, and I think this is going to be our mantra over and over for Dr. Bravo. We must suppress and suppress the virus. How do we do that without a vaccine? No. So you need to do your vaccination. And if I will summarize that of Dr. Silva, we have different ways of vaccinating depending on the alert level of the area, whether it's blue or red. So what we're doing today, depending on the area, will be containment, community mitigation. But if ever we have limitations, at least do the primary series, no? So, and again, it is not enough that we classify one area as blue sublevel, red sublevel. We need to always take a look if it's still appropriate on a weekly basis, because you can go higher or go lower depending on the situation in the area. She also emphasized to us a lot of good practices in the different areas. Specifically, the more the LGU will support vaccination, the more successful it's going to be. As she said, there should be ownership of the LGU for vaccination. And she also told us about the success being due also to the support from religious leaders, the community leaders, the barangay health workers, and the midwives, because they are the ones who know the population best, no? And they are the key advocates for vaccination. And of course, especially in the COVID-19 era, the barangay tanods, no? To take care of the crowd, no? We have to integrate other services like nutrition. And as a parting sentence, what did Dr. Silva tell us? We must move as a country to curb the polio epidemic, no? So that wraps up today's webinar. So thank you, Dr. Bravo and Dr. Silva. At this point, of course, we would like to thank our partners, the City of Manila, the Philippine Foundation for Vaccination, the UP College of Medicine, Philippine General Hospital, and the Mu Sigma Phi Foundation. And of course, our sponsor, Merck, Sharp, and Dong, no, for supporting us in all our advocacy, for sharing valuable knowledge as a tool in maintaining Swan health and preventing diseases. We also have a lot of media sponsors. Thank you so much. Thank you so much. Business Mirror, Daily Tribune, DZRH, DZXL, Malaya Business Insight, Manila Standard, Philippine Daily Inquirer, Philippine News Agency, and Radyo Pilipinas. Okay, this webinar and our previous webinars, Balik Tiwala, Balik Bakuna, Debunking Vaccination Myths, and the second one, Vaccination Timeline in the midst of the COVID-19 pandemic, are all uploaded on our Facebook and YouTube sites, no? So we would like to invite you to the next webinar of the Dr. Salvacion R. Gatchalian Memorial Webinar Lecture Series in Pediatrics, Management of Acute Seizures in Children. This will be on September 8th, Tuesday, from 12 to 1 p.m. No? We would also like to invite you to the webinar, Diagnosis and Management of Subclinical Thyroid Disorders. This will be under the UP Med webinars, which will be on August 26, Wednesday, from 12 to 1. Okay? And we would also like to invite you to the Immunity, to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app, which features, number one, immunization record and tracker. So all of us can really use it, and we can ask our patients to take a look at this. Number two, information atlas on all the vaccines available in the Philippines. And number three, frequently asked questions and myths on vaccination. It is currently available for free. I think that's the magic word here, no? For free on Google Play Store. You search Immunity Mu Sigma Phi Medical Sorority Incorporated, and click install. And that's it. Okay. Of course, I would like to invite you also to my webinar this Friday, basically for the OBGYNs in the group on recurrent pregnancy loss. No? So thank you to our online audience who has tuned in to today's session and joined us in this three-part webinar series entitled Immunization in a Time of Pandemic. You and I, we all play a role. We need to know the truth about vaccination. We need to continue the fight against COVID-19. Our health system is currently struggling with the coronavirus. Let us not add to this problem by including mortality and morbidity from vaccine-preventable diseases. Let us help fight the epidemic of fear. We need to tell everyone that there is a way to make it safe. Contact your healthcare provider and get your vaccines now, today. Get your vaccines. Thank you so much, everyone, and have a good week ahead of you. Thank you so much, Dr. Bravo, Dr. Silva.
Thank you very much.
Thank you, Lilibet. I see you.
Thank you.
We'll have a
Thank you for joining us in our webinar today. The Mu Sigma Phi sorority would like to thank our partners, the City of Manila, the Philippine Foundation for Vaccination, the University of the Philippines College of Medicine, the University of the Philippines Manila Philippine General Hospital, and the Mu Sigma Phi Foundation. The success of this webinar would not have been possible if not for Merck Sharp & Dome, our advocacy partner for public health, the Postgraduate Institute of Medicine, and the UP Manila Information Management Service. We would also like to acknowledge Mayor Francisco Isko Moreno Dumagoso of the City of Manila, Vice Mayor Honey Lacuna Pangan of the City of Manila, Councilor Lay Lacuna, President of the Liga ng mga Barangay Manila Chapter, for their valuable assistance in this project. We would also like to thank all who have helped the webinar team in every way possible. Most of all, we thank you, our participants, for spending your time with us. To receive your certificate of attendance, kindly answer the evaluation form by visiting the link on your screen within 7 days. The certificate will be emailed to your registered email address within 2 to 4 weeks. For any questions, please contact us at immunity.msps@gmail.com or muwebinars2020@gmail.com. For more details and updates, please check our Facebook page at facebook.com/mspsimmunity and our Twitter timeline at twitter.com/immunitweets. Today's webinar recording and all webinar recordings may be viewed at the Immunity Facebook page and on our YouTube channel at tinyurl.com/mspsimmunitywebinar. This webinar and our previous webinars under the COVIDGILANCE series entitled Balik Tiwala, Balik Bakuna, Debunking Vaccination Myths, and Vaccination Timeline in the Midst of the COVID-19 Pandemic are posted on our Facebook and YouTube pages. We would like to invite you to the next webinar of the Dr. Salvacion R. Gatchalian Memorial Webinar Lecture Series in Pediatrics titled Management of Acute Seizures in Children. This will be held on September 8th, Tuesday, from 12 to 1 p.m.
We would also like to invite you to the webinar Diagnosis and Management of Subclinical Thyroid Disorders under the UP Med webinars, which will be held on August 26, Wednesday from 12 to 1 p.m.
We are also hosting Munting Kwento, a virtual storytelling for kids and kids at heart, featuring a series of Gawad Panitikang Pangkalusugan books that aim to promote good health and well-being among children. This initiative provides an avenue that highlights literary value and provides an alternative learning environment for children, especially during this global pandemic. Stay tuned for a new story every second and fourth week of the month. You may watch it on Facebook at tinyurl.com/MewHealAdvocacy or in YouTube at tinyurl.com/muntingkwento. We would also like to invite you to download the Immunity mobile app. It is a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions or facts and myths on vaccination. It is currently available for free on Google Play Store. Search Immunity Mu Sigma Phi Medical Sorority Incorporated and click Install. Thank you and keep safe. Sama-samang aksyonan, COVID ay iwasan.